Hi, and welcome to the second episode of Get Informed. And in today's episode, we will be discussing about the use of NSAIDs in COVID-19 patients. So a little context as to what NSAIDs are. NSAIDs are non-steroidal anti-inflammatory drugs, and they do exactly that. They reduce pain, they reduce inflammation, and can also be used for fever reduction. Some examples of these medications include Advil or ibuprofen, naproxen or Aleve, and baby aspirin. Now, back in March, there was a huge commotion regarding the use of NSAIDs in COVID-19 patients. And this was primarily kickstarted by an opinion paper submitted to the Lancet Journal by Fang, Roth, and his team, in which they hypothesized that the use of NSAIDs, specifically ibuprofen, can lead to detrimental effects in COVID-19 patients. The same comments were reiterated by a health minister in France who later retracted on his statement. However, is there any proof to this statement? Well, the WHO conducted a rapid systematic review in which they looked at multiple studies. There were a total of 28 studies in adults as well as 46 in children. And here's what they found. There was low certainty to suggest that there was an increased risk of death rates specifically when it came to the use of NSAIDs in both adult and children for managing fever and acute respiratory viral infections. Furthermore, it was found that there was moderate to high level of certainty to suggest there was little to no difference between acetaminophen and ibuprofen in children who were being treated for fever with regards to the rate of death, hospitalizations, acute kidney injury, and as well as gastrointestinal bleeding. And lastly, it was found that there was unclear evidence to suggest that the use of NSAIDs when treating patients in acute respiratory infections led to an increased risk for ischemic and hemorrhagic strokes as well as myocardial infarctions. Now, having said all of this, there are some drawbacks to the rapid systematic review. And namely, it's this, that because a lot of the studies in this review did look at acute respiratory infections, however, none of them really specifically looked at COVID-19, SARS, or MERS. Now, given the current level of evidence, the use of NSAIDs should not be disregarded. However, acetaminophen is still the drug of choice, especially in those patients where NSAIDs should be avoided. And these patients generally include those that have high blood pressure, are suffering from an acute kidney injury, or who have a history of stomach ulcers. Now, hopefully today's video was of some benefit to you. If it was, please share it with your friends and family. And until the next video, please stay safe and stay informed. Thank you.